So let's begin the meeting. It's the Faculty Advisory Committee meeting for July 17th, 2020. In accordance with the Governor's directive, we're recording it and we'll place it, I believe it goes on to YouTube somewhere, in a channel just for CSCU things, for those people who want to follow all of the committees and all of the meetings. That said, why don't we introduce ourselves? Alice Pritchard we have a number of guests today. Alice Pritchard, who is Chief of Staff for CSCU, has come to talk to us about the questions we have about healthcare measures to be taken for reopening of campuses. And Bill Faraklis from Public Health in Southern is also here. And I think there's one other guest. It's Fred Latour, who's president of the CCSU Faculty Senate. But let's also introduce ourselves, perhaps in alphabetical order. So we'll start with Alice.
So, hello, Alice Pritchard. I've been to the FAC before, but not with this particular group, so I don't know many of you, so I'm happy to put names with faces as, but Chief of Staff, which I have been for almost 5 years now. I should say, and the reason you get me today is because I'm leading the reopen efforts, for the system.
Okay. Call-in user 2, that's Barbara. Barbara, can you hear us? We'll come back. Call-in user 3, that's Steve.
Good afternoon, everybody. Steve Marcellinus. I am the newly appointed Director of Transfer and Articulation for the System Office, here primarily to talk about the revitalization of the TAP Coordinating Council. Thank you.
Good. Colina?
Hi, everyone. Kalina C. Sankar. I teach philosophy at Gateway and am chair of the FAC.
Okay, David Stoloff.
David Stoloff. I'm a professor in the Education Department at Eastern Connecticut State University, and that's a good start.
Okay, Bill Faraklis.
Hi, I'm Bill Faraklis. I'm from Southern Connecticut State University. I am a professor of public health there for a long time. I just want to say thank you for inviting me to your meeting today. It's good to be here. And nice to see you, Alice.
And you have a very good camera on your computer. We have a nice high-D picture. Okay, Francis.
Francis Cohn, professor of history, Tungus Community College.
Okay. Another guest, Fred Latour.
Hello, I'm Fred. I am the president-elect of the Faculty Senate at CCSU, and I'm an associate professor in the Department of Mathematical Sciences.
Okay. Jennifer Long.
Sorry. I'm Jennifer Long. I'm professor of English at Three Rivers Community College.
Okay. Linda Wilder.
Hi, this is Linda Wilder. I'm with Charter Oak State College.
And we serve together on that working group. Mary Beth.
Hi, I'm Mary Beth Wojcicki. I teach math at Nantucket Community College.
And finally, Myrna.
Good afternoon. I'm Myrna Garcia Bowen. I serve on this committee as the SWOF representative for the CSU system, well, actually a CSU system, and I work at Central Connecticut State University.
Okay, so.
David?
Yes?
It's Barbara. I was having trouble getting off mute, but here, I've been here. I just wanted to introduce myself. Barbara Richards from Housatonic Community College. Thanks.
Oh, okay. Sorry. All right. Let's proceed then with our agenda for today. The first business is simply the approval of the minutes from the previous meeting. I think we all received that, or it was in the package, but I'll put it I'll share the screen. And you have the minutes. Lois, Amy, who normally would be here, isn't here. But if there's any modifications to the minutes, let me know. They're usually quite complete. In her absence, I'm wondering if somebody would volunteer to serve as secretary until she's able to join us. In any case, we're recording the meeting, so we can always go back and extract the minutes from the recording. Are there any changes or modifications to the minutes from the last meeting, the meeting of June 12th? If not, is there a motion to approve them?
Fran Cone, so moved.
Okay. Those in favor, say aye.
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 Those opposed, say nay. Okay, they're approved. Let's go on to the main item, or one of the major items for today, which is the health and safety procedures for campus reopening. For that purpose, as I indicated earlier, we've invited Ann Pritchard, who has responded to a series of questions that we had based on concerns that have been expressed to me by members of the FAC, by folks at the steering committee of the CCSU Senate, and by other faculty members in conversations over the last several weeks. Maybe we can let Ann begin and sort of, summarize exactly where are we in the process of establishing health and safety procedures for the various campuses.
Great, thanks, David. And just to correct you, sorry, it's Alice. Again,
I'm sorry.
It's all right. You said it right the first time, and then,
Yes.
But Ann is always the default. I'm not sure why. That's quite all right. So actually, yeah, probably rather than doing the details of the questions I responded to, though, I'm happy to take those. We are getting really close to the launch of phase 3. And phase 3 calls for the repopulation of our campuses. It'll be interesting to get your thoughts on this as we go through. I've spent a lot of time with public health in the last couple months trying to understand this. But anyway, we're about to enter phase 3, which is what the campuses have really been planning for, which is the repopulation of students onto the campuses. And I think it makes sense to talk about these in the 3 constituent units. And I'm going to start with Charter Oak because they never get to go first. But Charter Oak was, obviously in a different position than either of the other institutions because all of their instruction was already online. But they did have to make changes. They did also have to go to remote in terms of their student services and not being on staff, at their office buildings. They will reopen their offices in a little bit later this summer, towards the end of August, I believe, or the beginning of September. But they will continue to maintain their online courses, obviously, and actually, I believe we'll have even more remote services available to students. So Charter Oak had a slightly easier go of it, though I will say that their students didn't necessarily, because many of their students are frontline workers who had additional hours and things and had to forfeit their classes this spring as well. And Charter Oak, just as an aside, refunded about $500,000 in tuition to students who couldn't complete the courses this spring, and allowed them to take them at a later date. So Charter Oak often doesn't get talked about in this context, but there and the repopulation of their buildings will be part of the phase 3 process for them as well, and will outline all of the health and safety needs of their office building, where they do see some students, but not nearly as many as the other institutions. Then the universities and the colleges will also, every institution must submit a plan for phase 3. And if you watch the hearing this week, the plans have to talk about the repopulation of students. They have to talk about how they're going to monitor health. They have to talk about how they're going to contain the virus, and that's particularly, or containment, which is particularly a university issue and not so much a college issue. And then how they would shut down. What are the conditions under which they will shut down? Most of the schools will have those plans prepared probably the first week of August. Some of them are close to finishing them now. It's a big piece of work. There have been a lot of planning activities going on to support that. You may know, just again as a bit of background, that the universities had 4 steering committees that came across institutions to bring forward ideas. So they had a group on academic affairs and enrollment management, on operations and logistics, on technology, and on student engagement, student activities. The community colleges did a similar thing, but had 3 committees covering all the same topics, the first ones were led by the university presidents, and the second by the regional presidents for the community colleges. And those groups had a cross sector of leadership, I suppose, from the different campuses, provost, facilities leaders, IT leaders, and all of the bargaining units represented in CSCU were on one of those committees. And those groups did their work early, but also in alignment with what ultimately will come out in their phase 3 plans. But so the phase 3 recommendations came out in May. The framework rather came out in May and asked a whole lot of different questions, everything from how you're going to handle your dining hall to how you're going to handle contact tracing. And the schools are all expected to answer all of those questions, and they will address many of the things that you all had that David had sent the questions about as part of that plan. So some of what I've given you in answers is stuff that I know was in the works. In other cases, I said to you, let's wait and see, the plans are coming. We have attempted to provide some guidance and some framework and some guardrails. I'm trying to think of all the right words, so that schools are relatively consistent in their response to these issues, but also have tried to give schools the flexibility they need to address their different student populations, their different geographies, their different buildings, and capabilities. So campuses have made the ultimate decisions on what will happen there for their faculty, staff, and students within guidance from the system office and in regular communication with the campus leaders in weekly meetings that we have with them. So what I can tell you is, again, we are in, all of these recommendations have been made in consultation with the Department of Public Health. Today I'm going to be, on behalf of President Ojakian, issuing an updated framework for phase 3, which takes into account some new thinking on testing in particular, which we can talk about if you like. So that update will go out, and that's the one that we hope the schools will be responding to. We keep telling people you have to be flexible, but things change, and so the rules may change as we go forward. But that will come out today, as well as some new testing guidance to take into account the fact that the governor has done a travel advisory, which will probably only get more conservative as we get later into the month of August. So there's been a tremendous amount of planning at the campus level. There have been lots of changing rules that they've been trying to take into account, and so I'm happy to entertain your questions. There were a couple that I wanted to kind of correct that were in here on health and safety that I could take up. But I thought the 2 things that I thought we might talk about were testing, which again, I should clarify, is only for the universities. The community colleges are not required to test any students. And I can talk a little bit about that reasoning on behalf of public health. But I thought testing might make some sense. And then you had a number of questions around kind of the PPE and masks and social distancing, and how are students going to know, how are faculty and staff going to know kind of what the rules of the game are. And I think those things are still in the works, but happy to hear your thoughts about that. So I've rambled a bit. Is there anything else you want me to tee up to speak to specifically? At the moment, I can start with testing if folks would like to understand testing.
Let's begin with testing. That makes sense.
Okay.
This is Jen Long. Can I ask a quick question?
Sure.
I'm not sure if this is something that would be in this conversation,
Sure.
but I just thought I'd ask. I know on my campus, folks are frustrated with the backlog of ADA requests. Do you happen to know if anyone is going to be helping that office facilitate those requests so that faculty, especially people who have children in the school system, need to make decisions, can know if their ADA requests are being granted in a timely manner?
Yeah, I will bring that back. I know that there have been many requests for an ADA consideration, and I think we were hoping that folks would have the academic schedule in front of them, so that folks, particularly who turned out to have a fully online or remote portfolio, didn't ask for an ADA accommodation because they won't need one, versus those who might. But I'll check on that. I'm happy to, and Jennifer, and see what the strategy is to move those. But the volume has been tremendous.
Thank you. And I appreciate that. I just wanted to say that there is, for what it's worth, there is a cohort of folks who have children who are considering the online thing and have to commit for the year. So if they have their request and their request is backed by evidence and the request is for the academic year, the fall, because I know some people were saying that their sort of curt response was, you're probably all set for fall, and people were wondering about those people, the request for the year accommodation or more.
Well, and again, the reason that might be the case, and again, I'm not in the HR staff, but if by some miracle, and it seems like be a miracle, that there's no occurrence of COVID come January 15th. Then if your accommodation is COVID related, it would no longer be a valid accommodation. So I'm sure that that's part of the thinking, is that we just don't know whether the same conditions are going to be in place in the spring that we have today. Although I have to say, most days people feel like we might be doing this for 18 more months, not just 4 more months. So that could be the issue, Jen. But I'll be happy to bring that and ask somebody to reach out.
Thank you so much.
You're welcome. You're welcome. It's really complicated, I know. So testing, only applies to the universities, and the guidance has changed over time. Today's guidance, which is going to come out after I'm off this call with you all, is that in-state students who are moving into the dormitories will be required to have a test prior to moving into the dorm. And the guidance encourages testing as close to move-in date as possible, because we want to make sure that the test is as relevant as it can be. I mean, again, you all know testing, as I have learned from the public health folks, testing is kind of a cleaver, not a scalpel in this strategy. This is a terrible analogy, but and that we're not going to test our way out of this. The testing is fine, but unless you are really testing on almost a daily basis, the time in between tests allows somebody to be exposed again. And so, but anyway, so students are being asked to come to campus to move into their dorms with a test from Connecticut. Right now, if they live off campus, they're not required to have a test. Or if they live at home. That could change. If Connecticut spikes itself, then commuter students might have to be tested as well. But with the low prevalence, public health is saying there's no need to test Connecticut kids who are living at home or off campus. Out-of-state students, and in an abundance of caution and to make it easier on ourselves, every out-of-state student, so whether you're from a hotspot or you're from the lovely state of Rhode Island, you have to come also with a test. You also are going to be encouraged to quarantine for 14 days upon arrival to the state of Connecticut. It aligns with the governor's travel advisory. Public health will tell you, and maybe Bill will confirm this for me, that quarantine is the best way to address this, that testing is not the issue, but that quarantining and making sure the spread is limited is the best hope of keep containing the virus. Bill, do you want to jump in? You want me to be quiet for a minute?
Sure. So yes, you're right. Quarantining is critical. The problem is that we're talking about self-quarantining, which we know we can't depend on, right? 100%, maybe not even 50%. We don't know.
Yep.
But that becomes a problem because a true quarantine is an enforced quarantine, right?
Right. And yes, so we are doing kind of a best quarantine possible. The guidance is going to encourage the universities with students moving into the dorm to quarantine them in the dorm and to make that as real a thing as we can make it, and to encourage off-campus students to do the same. Now, the off-campus students is just a wing and a prayer, but potentially the schools are going to be in a position to quarantine those students. That means they have to come back even earlier than planned. But in addition to their quarantine, the guidance is that they be tested again, and that they be tested either upon, upon arrival, or each school must sample test 5 to 10% of their campus residential students every week. And so the recommendation is that the out-of-state students are the first students that you test. Again, we're kind of bludgeoning this one to try to manage what is potentially an influx of asymptomatic students, hoping that the symptomatic ones are not coming. Yeah, Bill, go ahead.
Alice, may I just thank you for this information. It's very important. May I ask another question or two, please? The quarantining will not be individual quarantining. Is that correct? It will be group quarantining because they'll be sharing restrooms. They'll be having meals at some point during the day. So it's a semi-quarantine.
Right. It's kind of a pod. They keep talking about pods, which students have said they hate that terminology, but they're kind of, creating bubbles or pods to do that. Yeah.
And may I just say one other thing? I understand that you want students to be tested as near to the time that they are returning to campus. There is a related problem, which is that apparently it's taking a long time for test results to be reported. So you can have someone who claims to have been tested and can prove to have been tested, but may not be able to present results within 3 days, 5 days, 7 days in some cases.
Right. So in that instance, the recommendation is if they can't document their negative test, that they come and they can be quarantined until their test results arrive. And that's really for the Connecticut students. The Connecticut students can be freed from quarantine as soon as they get a result, again, because we have good prevalence. If it changes, they're going to be in lockdown with everybody else. So that's kind of where the testing guidance is at the minute, because I was just finishing it up before I got on this call.
Thank you.
I have a question, if I may, with regard, Myrna Garcia Bowen. Once a student, if a student tests positive, what is the protocol for the contact tracing? Because these students, you would assume, would have had some contact in a classroom, correct?
Yep. So each of the plans that are coming in under phase 3 will outline exactly what each of the 4 universities are doing. So they're all going to do something slightly different. But for the most part, the first thing is that if they test positive, they're supposed to be moved from their dorm room into space that's been set aside for isolation. Their roommate possibly will be moved to a quarantined dorm room. So each of the campuses was required to set aside or have available 10% of their capacity in either isolation or quarantine space. So students are expected to stay on campus where they or their parents don't want them to come home. But they are expected to stay on campus in these spaces, in either an isolation space or a quarantine space. And the plan that the schools are submitting has to talk about how that happens, how they get fed, and how they get monitored. Again, these kids may be sick, but from what we're reading, they may end up with GI issues and other stuff, not lung issues that put them necessarily in an ICU bed. So they may actually be in an isolation room for some period of time until they feel better. And again, Bill may be able to talk about this for Southern, but the plan for most schools at the moment on contact tracing, and I have to say, the state kind of held us up on this for a while because they really wanted a state strategy. But we've recently kind of pulled ahead and just said, if you catch up with us, that'll be great. But each of the schools has been encouraged to identify their own contact tracers and put them through a Johns Hopkins training that is the gold standard now for contact tracing. They will be the ones who monitor or who do the contact tracing for residential students. And they will have in two of the cases, I think it's Southern and Western, you have a data system on ground already that is used by health services that may be a data port for you. But the state is also asking us to be part of their system of public health data so that we know every positive case in the state is in one spot and be contact tracing from there. The local departments of public health will be responsible for contact tracing related to any commuter students, but the campus itself will be responsible. And the reason the campuses are responsible for contact tracing on the residential students is kind of to the point that Bill was making earlier, where we have concerns that it might take them a while to get to tell us that that student had been tested positive. We could be 2 or 3 days down, and that student could have taken down a whole dorm in that time frame. So we're going to tighten that time frame so that when students are tested, they will actually be tested on campus. And those results given directly to us so that we can move more quickly into contact tracing. And Bill, that just reminded me of the point you made about the lag time. The testing partner that we are hoping to secure is talking about a 24 to 48 hours maximum time frame. I believe that Quest, which is really getting pummeled right now as the lab partner, is doing stuff nationally, and I think is just didn't have enough bandwidth for the spikes in the other states that they're covering. So any other questions about testing?
Yes, I have a question about testing as well as saving. Why has it been decided that there would be no testing at all for community colleges?
So the public health guidance on commuter students, whether they're at the universities or the colleges, is that their testing will not help you. You'd have to test them every single day. Because they don't live on campus, because they stop and buy gas, because they go to the grocery store, because they live with somebody who works in the community, that testing is not a strategy that's reasonable for that level of activity. That where they really are focusing testing is on congregate living. And so that's, not to be equated with them, but as prisons and nursing homes and group homes and dormitories. But the idea is that they're not recommending it for public schools, for teachers or students, because of the porous nature of the classroom and the fact that they go in and out. So they're very firm on that guidance, that testing is not the right strategy to monitor folks who live and work in the community to the degree that those folks do. And it's really about congregate living. It's about sharing bedrooms and bathrooms, that they think the testing is more important. But Bill wants to weigh in. As our public health person, Bill wants to weigh in.
Yes, and I have the greatest respect for my colleagues at the State Health Department. I imagine you might be working with the state epidemiologist, Matt Carter, for example, a brilliant person and very capable. However, I think that the fluidity of contacts for our commuter students is actually the reason that they need to be tested, perhaps even more often than students who are on campus, because they're going to work, they are shopping, they're going home and congregating there with other people who are working out in the community. The opportunities for infection are much greater for them because of all the settings that they're in. And it's similar actually for our students on campus who likely go home on the weekend. Many of our students, because They need to be able to pay for school, have jobs in addition to being on campus. So in some ways, those two groups are indistinguishable. In other ways, they're distinguishable. But it is the multiple contacts that our commuter students have that really call for their being tested on a regular basis. And I want to say that testing is very, very important in addressing this pandemic. And we need nationally to ramp up our testing, maybe to, I think we've done something like 45 million tests since the epidemic in our country began, the outbreaks. We need to get up to a point in this country where we're doing about 30 million tests a day, right? So some testing is really not going to solve the problem. Contact tracing is very important, but it has a lot of holes in it. I was a contact tracer many years ago in public health. And the problem with this disease is that it is so highly infectious.
Yes.
And it is transmissible from people who are asymptomatic, and even from people who will never have a symptom, who will go through having a coronavirus infection and never know it. But they can be very, very highly infectious. And so these sort of legs on the stool have to be there. Probably the most important things are the wearing of masks, which, you know, I don't think we need the N95 masks on campus, but we also don't need flimsy homemade masks. So I haven't heard anything about who's going to do any quality control on what people are wearing. I think that's important. But I think there are some misunderstandings about how we're going to control this pandemic. And my vision of what's going to happen is that because we have a low prevalence in Connecticut now, and we have to remember that that wasn't the case a few months ago. We suffered tremendously here. We worked very, very hard to bring the prevalence and therefore the incidence of this disease down. But we have seen sudden and severe outbreaks throughout the country in places where there was very little disease, right? And so what it will take is only a few students coming to campus with the virus to spread this disease. And I think I should probably stop there, but I want to say one last thing, which is we assume that because students by and large are a younger population, that this disease does not affect them as much. And if they get it, it's not as severe. And I think we're finding that that's not the case. And I think what we're finding now more than ever is that people who have mild cases of coronavirus have really debilitating long-term effects. So I think we have to be careful not to think of our campus community as being a young population that's not all that susceptible. And then remember that there are a lot of people who are going to be working with them. And I haven't seen in any of the comments, and I might have missed it, Alice. I read it a couple of times, but there was a lot to look at. In the advice for people requesting to be allowed to work off campus, it seems to refer to disease conditions, high-risk conditions, but it doesn't seem to mention age. So anyway, I think I've said too much, but I'll turn my microphone off.
Is this why you invited Bill, so we could talk, Bill and I could have this conversation?
Well, let's go back to the testing and focus on that. And let me just add a comment that some faculty have made to me. Imagine, Alice or Bill or anyone, that you're now teaching a class, and in front of you in this high flex format, separated by several seats and what have you, only 15 students in a class of 30, you have these 15 students, but you don't know who's a commuter and who's a residential student. Now you know that some of them have been at least tested, at least. It's not a guarantee, but it certainly reduces the risk. But then you know others have not been tested at all. It seems to me that this is just going to be a factor of insecurity for faculty, but also for the other students in the class. A student who's been tested is sitting next to a student who hasn't been tested, and they may not want to do that.
Well, and again, I think that the most important thing, what public health says to me every time I talk to them, is the two most important things we can do is enforce the wearing of masks and the physical distance. That's what's going to help us here. That testing is not, because that kid could have been tested last week and gone to a party on Saturday night, and we don't know that they've been exposed. So testing is, I mean, testing makes us feel better, certainly, but the real things that should make us feel better are people doing those two very simple but critically important things: wearing their mask and staying separated. And that's really what they are pushing. And believe me, they don't. And Bill knows this too. I mean, Albert Coe was on this group, and others, really good epidemiologists, and they just, this is where they landed on the conditions that were before us. And daily testing is not gonna be a reasonable strategy. And so the testing strategy is test a random sample on a regular basis, and really push the mask and social distancing.
But that random sample will only be the residential students.
Actually, that out of state, it's going to be recommended that the out of state commuter students be wrapped into that weekly testing as well.
But it still doesn't cover the commuters.
May
the
I
in-state
just
commuters.
I'm sorry.
Go ahead.
So I just want to say that I actually taught a class at 12:15 on the day that my campus closed. And I was walking into class questioning everything about myself, right? I didn't know whether I was being too anxious and was being irresponsible by considering canceling that class, or whether I was being irresponsible for walking into the class. So I've had the experience of sitting in a room with people where you're trying to engage them in discussion, and people are literally afraid to breathe. So I just want to say, like, all things being equal, I know that all of us who teach understand that in-person instruction is vastly superior to online instruction, but in-person instruction under conditions with all of this uncertainty is almost impossible. So that anxiety about who's been tested and who hasn't been tested, and is this person's mask, good enough, and that sort of thing. I just can't imagine running a class in that way. So I hope that that's being taken into consideration also, because not all of us have had that experience, but it is weird.
Well, and again, I think there are certainly students who, in surveys, at the community colleges, and we should talk about the community colleges for a little bit, but that at the community colleges who have really said they want to be back in the classroom. I think they recognize that that's the preferred learning style for them. And so I think that those who are, kind of fighting to come back, hopefully are going to be all the more vigilant in behaving in ways that will help us to manage the situation. So, I'm hopeful that we're going to see the mask wearing that we've all gotten very used to over the last 4 months, and that the classrooms are going to be distanced in a way that they, hopefully will respect, because that's what that work is about. And I do think I do want to say that the N95 mask, I said it a couple of times in my responses, is not what's recommended for all of us. They really want us to keep those for the public health folks and the frontline workers who are close to people who are sick. That's really what that's for. And we've been watching in hopes the CDC might get a little clearer about which masks are good, and lacy masks are not so good, and nylon is terrible, or whatever. But they have not really helped us much on that. But so the public health folks are still saying a face covering. They're not even worn properly. Again, I think the number of people I see who have underneath their noses, really, it's like, cover your nose, please cover your nose. But the schools have secured a lot of masks to disseminate should people not have them. I think, again, most people, and I've been very pleased, most places I have been in public, that there's a lot of mask wearing. There's very few people who are not abiding, and many more businesses are now saying that you can't come in without them. So most people, I think, are starting to have masks at their disposal, some of them quite sophisticated and beautiful. So I think that folks are going to come with some, and I know the universities have actually purchased some that's, you know, that they'll make available that have lots of, you know, glitz to them. But the schools do have masks available for students and faculty and staff who do not have their own. And one of the things I wrote in there is that each one of their plans for reopening will talk about how and where you get those supplies, so that that's clear to folks.
Alice, this is Jen Long. May I ask another question?
Please, please. I'm gonna try to make my answer shorter too, so you guys can get to more questions.
So I had a similar situation with Colina, and I was petrified to be in that classroom. And I also can speak to the behavior of many of my students and the very real concerns of them taking masks off, not wearing them over their noses. You know, you have one situation where it could literally take a moment to take their mask off and sneeze and cause a big problem, right? And that we're not always talking about necessarily the super responsible graduate student, right? We're also potentially talking about people who are not making the best decisions with their physical bodies, right? And there's also a real political element to the mask wearing as well. And in many of our classes, we're talking about politics, and those conversations can get charged, you know? So I think there's a lot of real risk that should be taken into consideration in terms of classroom management. And I'm just wondering, is there any consideration for mental health services being beefed up on campus, security being beefed up on campus? What do instructors do if a student, you know, gets upset about a grade and takes the mask off and coughs on the person? You know, things like that are really possibilities. And then my other follow-up question is, what exemptions do students have if they say, I don't want to be tested for whatever purposes, or I can't wear a mask for whatever reasons? To what extent is the person to be in the classroom? Thank you.
No problem. So you did many things. So the mental health services should again be a concept discussed in their plans. So there'll be more of that. I did share with David and Kalena yesterday the student policy on compliance with mask wearing. So, you know, again, if a student, you know, I'm kind of hoping that a student is caught much before they get to a classroom having not worn their mask. You know, I would imagine somebody who's brazenly not going to wear a mask in class is not going to wear it in the front door either. And so, you know, hopefully there have been several checkpoints that they've gotten through, perhaps, where somebody has said, you know, you need to wear your mask, you need to wear your mask, you need to wear your mask. But should they arrive to your classroom, that guidance is that you ask them to do so. And if they refuse to do so, you ask them to leave the class, and it goes to students' conduct, because it is part of the student code of conduct. So that policy, look at that. That was talked through with both the colleges and the universities, with the student affairs deans, so that hopefully, again, this is a rare occasion and not a regular occasion. I think that the mental health question is a good one. I do think there are going to be some folks for whom that is the reason for their lack of compliance, and so I think we need to be mindful of that. I think that we're discouraging the concept that the first thing you should do is call public safety, because we do not want to escalate matters. But as in every other circumstance in a classroom, if you have a disruptive student who is dangerous to themselves or to others, you call for backup, and that's to be expected. It just shouldn't be the first call, because we do not want to criminalize this behavior. We're trying to socialize it as responsible and conscientious, certainly. And I'm also hoping that what both you and Kalena experienced in March will be a bit different now that we're 4 months and we'll be 5 months in, and that people have come to understand the virus more, how they can participate in managing it, et cetera. But that will not, yes, you're right, that will not be for all people. If a student refuses to wear a mask, they're going to be encouraged to take one of the online offerings that's available to them. And that's going to be a conversation. Disability services is a different thing. Disability services we need to deal with, where a student can't wear a mask for health reasons, or We've had the discussion about a student who needs to be able to read lips if they have a hearing impairment, that kind of thing. So those things definitely need to be part of the planning. Helena, you're raising your hand, but you're still muted. There you go. Okay.
Yeah. So, according to the, I don't remember what this document that I'm looking at is, but I think it's like the student guidelines. It seems to suggest that a student who can't wear a mask for some medical reason or something like that will be allowed on campus, just needs to have an accommodation filed with the appropriate office. Is that right?
That is probably right, because again, we can't deny them access based on their disability to the campus probably. So, but I think that in that case, there's probably going to be an accommodation which needs to be discussed with the instructor. So I'm making this up, but let's just say that Johnny can't wear a mask because he has a breathing impairment that's going to cause a problem, and he insists that he really wants to be in the class because he cannot learn math online. It may be that he has to be, he has to enter and leave at a different time than the rest of the students. That he has to sit, poor thing, in the back of the room, more isolated than the 6 feet. He has to do 12 or 15 feet away from stuff. So they're going to have to think through how they balance, his right to an education and the accommodation of his disability with the instructor and the rest of the students in the classroom. So those are going to be on a case-by-case basis, I'm sure, to make sure that those things can get addressed. But I know that they're having these conversations now with the disability services folks to think those through. They're thorny.
So
those are very thorny.
From that, sorry, someone's talking. Go ahead.
Okay.
Well, let me ask a question.
Yeah, Paul's waving too. I don't know I don't know if I'm calling on people or you are, David.
No, that's all right. I do see Paul now too. Paul, go ahead. You're not on speaker.
Hi, yeah, thank you. I'm sorry, I just got on a few minutes ago. I had to go to another meeting I couldn't get out of. And so this might have been addressed, but thank you for coming today. I appreciate it. My question is, I teach at Capitol and there are lab components that are involved. And I was talking to a couple of people this week about how they're setting up the rooms. They sent me a couple of pictures. And in a normal classroom that would hold, say, 20 students, the way they're setting up the classroom, it won't hold any more than 10 students. Their proposal now is to put the remaining students in a lab, which is across the hall with a screen and then, visually projected into another classroom. So if you already addressed this, I apologize. But I see that as problematic if you're teaching students, and I want to be on ground just as much as anybody else does. I love being in the classroom. But if you've got half of the students in a class and half are in another lab looking at it on a monitor, I see that as a disincentive for the student because they can think, well, if I'm just going to look at a monitor, I might as well stay home. So I don't know how much of that has been addressed just in the room, because we're constantly told we need more classrooms, and now if there's a class that holds 20 students that can only hold 10, now we're going to need twice as many classrooms, and half of that is going to be perhaps projected on a screen from some teaching in another class. Thank you.
No problem. And Paul, I would encourage you to talk to Dr. Harris and see what the plans are there at Capitol specifically. But it sounds a little like the high flex model, which some of our institutions are going to do in a pretty big way, and others are going to do a little bit of. The idea with high flex is that those students might change. So on Monday, I'm the kid in the room with you. And then on Wednesday, I'm the student in the classroom across the hall, so that their educational experience gets balanced online to on ground a bit, certainly. But yeah, the classroom limitation space was really a primary driver in what gets offered on ground and what gets offered online. I think the labs are a challenge because, you know, there are some students who really, I mean, I'm hearing really good things about the lab software, that folks really liked it. But again, there's some students who really going to want that in class. And so the only other option is that we offer lots and lots more classes. That didn't seem like a feasible strategy in most cases either. So, but I would check in about what the plans are now that they're thinking about splitting that class in half.
Yeah, I've spoken to them this week. Like I said,
Oh, good. Okay.
they've been in the classes and sent me pictures. Thank you.
Oh, of course.
Alice, you mentioned earlier checkpoints, and I was, you know, sort of situating things as if we were the instructor in a class and we're just beginning there the first day of classes. It would certainly be better if a student who doesn't have a proper face mask or doesn't have one at all, but more likely doesn't have a proper one, had been sort of stopped already at the entrance to the building. And that's the whole question of having, you know, a desk at the entrance to the main entrances to the academic buildings where students are apprised of, asked if they have their mask, checked to make sure that it's the right sort, directed to the hand washing station. And I would add, although I understand that this is not being planned, although I think it should be, have temperature taken because we're going to enter into flu season. And then how are we going to distinguish, you know, we have students who are going to come in sick with the flu. So it seems to me that one of the things that should be part of a general guidance for all the institutions, whether community colleges or universities, is that at the main entrances to the academic buildings, there should be these stations with properly trained people who can check for the face masks, direct the hand washing stations, give them a little pamphlet explaining what's going on, since it's not obvious that everybody's going to understand it in the same way. And I would add, do a temperature check. I just had to check in at Yukon Health Center this morning. They did a temperature check.
Yeah, I checked on it again today. It is not a recommendation. Temperature checks is not a recommendation.
I know that, but this would catch people, right? And it would catch a significant number. And it would also, again, be assurance to faculty and to the students who are participating in these high flex classes, because that's a problem of confidence that is going to be.
Well, I think that part of the reason is that they no longer see fever as a primary, you know, it is a symptom for some, but not necessarily all. And there are people who will never have a fever, who, you know, you're stopping and checking. And they also do not like the queue that creates where you've got folks kind of, you know, getting in line. So on the checkpoint concept, I think that in many cases, schools are going to limit their entrances to buildings, so that there's not this kind of free flow, everybody coming and going. That does have some limitations. Again, if you get too many students trying to get through a door at the same time, you're going to ruin the social distance, physical distance activity. But again, I would imagine that in those plans, each one of the schools is going to talk about how they're going to communicate to students, how they're going to get them PPE or mask if they need it, that each school has got that in their phase 3 planning for sure. And in some cases, it'll be a single check, you know, checkpoint's not a good terminology because those are really military, I suppose, but, you know, one or two entrances where they're also checking IDs. And the other thing that schools are going to potentially do for the first time is say to visitors who just want to come use the library that they can't. That it really is, there may be schools where you have to show an ID to get into the building, both for, you know, public safety purposes perhaps, but also because we're going to limit the visitors that can kind of wander in and out of the buildings, and bring that with them. I saw Mary Beth. Well, I haven't heard a question from yet.
I was actually going to ask a similar question to David's about entrances, and whether somebody would be there to, you know, ensure people had masks as they were coming into buildings.
I think that will probably be in many schools' plans where it's feasible. But again, I think schools may also have other solutions that they think work as well. So now they got to do something to get them in. And some people, that's already that's kind of a natural already flow of how you go into a school building, particularly the community colleges. But Francis, maybe.
Yeah, I do have a question. And I did see the higher ed committee hearing. I caught a good part of that. What is the threshold for taking some sort of action if there is an outbreak on a campus? I'm particularly concerned about the community colleges, but probably true for the CSUs also. I think you did answer the CSUs. You have some idea. You've got that 10% space
Yep.
set aside for dorm students. But I think it's more for the community colleges. If there is an outbreak, what then? What happens? When does it happen?
Yep. So one of the things they have to talk about in the phase 3 plan is shutdown and what would be the steps for shutdown. And those will definitely be in consultation. So put the universities aside, but for the community colleges, there'll have to be a consultation with local public health. And it's going to be a case by case basis. So I do not think that just because a person has been in the building that we're shutting down and going home the way that we did in March. So I think it's going to be much more, when were they there? How many people did they see? If they saw everybody and we got to clean the whole place top to bottom, then we're probably going to have to close for a day. But then I would expect it to reopen. So I think the reaction is going to be different than it was in March. I think there's going to be a lot more trying to live safely with the virus amongst us, not just at school, but everywhere that we all go, because waiting for a vaccine is a wait that's going to be, I think, much longer. So I think that will be the case. That it is also possible, I think, this time that we could that we would see individual schools close, maybe for a day or two, or even for a longer period of time, but not all schools close. So just as an example, I think in Danielson, they could have probably stayed open the rest of the semester because there ended up being a handful of cases in that area, and those students are very local. And so I think, if Norwalk might close for a day or two and Quinnebog wouldn't have the same experience this time. So that's also going to be a little maddening for all of us too, especially if you happen to be a adjunct faculty member who teaches in multiple schools. But I also do think, though, that this time we'll be able more seamlessly, hopefully, to move to remote. So, if we have to do a major clean and you had a Friday class, you still would have your Friday class. It would just move to a remote setting. And then the next week they go back on ground as soon as whatever contaminant had been brought in was addressed. So I think it's going to be much more fluid this time. But if there could also be, if I took New Haven as an example, if New Haven spikes and we don't even have any cases at Gateway or at Southern, you might still close them for safety purposes, or shutter them a bit, go to remote or online for a week or two, and then come back to campus. So I could see some back and forth happening too, because of public conditions, not just our conditions. So it's going to be interesting. For sure.
Can I just ask one more question?
Sure.
Thank you so much. I promise this is my last one, but I just want to share with you guys briefly something that hasn't been brought up. I work at Three Rivers, and I'm in a classroom has all windows, but you can't open any. And we have the heavy swipe doors, and you can't open the doors. We're told we can't prop them open because the key things run out of batteries if they're not closed. So once you're in, you're sealed in this room. And in addition to that, for the last, I would say, 8 years, the ventilation system was set up so that going backwards. So it was blowing the air back in instead of, the system was set up backwards when the campus was redesigned. And then there was a tremendous mold problem. So most of us would go home at night really tired, exhausted. The whole time I was pregnant, I felt really sick all the time. And they finally sort of admitted it, said they remediated the problem. But a lot of our campuses have old buildings in them, and a lot of the ventilation systems are poor. And I was just wondering, I know that this is probably not something they would do proactively to bring OSHA in to look at the ventilation systems, but if you could put it in as a recommendation that they consider having these types of things checked and looking at filters and stuff, and seeing if there are places where, because we were told we're not allowed to open windows even if we have them in the classrooms, things like that, right? I just wonder, because I was just thinking briefly about the scenario that you said we talked about before, where students disruptive, we call security, and the students removed because they took their mask off and they sneezed or they coughed on someone. If you can't open a window and you can't get any ventilation, you would probably have to cancel class anyway, because you wouldn't want to be sitting in the closed room. So I think that might be, I don't know, I'm not an expert on it, but I just think that given the state of our buildings in the state, we might want to consider looking at that as well. And so thank you so much for your time.
Oh, no problem. And they definitely are looking at, you're absolutely right. Some of the buildings can't take like, some super women new thing when it was built in the 60s, but they definitely are looking at, facilities folks are looking at filters to the degree that and changing them more regularly. So they have some guidance related to looking at airflow. But I understand that concern. I also I'm just struck by the fact that you guys have all these sneezing, coughing students, and hopefully you don't have that. But also, you may have the defiant mask wearers having no symptoms whatsoever, just being defiant mask wearers. So I think if people are not feeling well, they're hopefully not in your classroom to start with, and they're not sneezing and coughing all over everybody. But I just that image is very unsettling. I would agree with you. So I know you all have other things on your agenda. So just again, for I would suggest two things. Each of your campuses, as I said, each of your campuses will be doing a phase 3 plan, which they should be making available in very early August. I would expect them by, August 3rd. There have been some really deep planning efforts going on campuses. So I know there are a lot of people involved, and you may already be involved in those, but they will certainly make those public. They have to submit those to the Department of Public Health to put on file, but Public Health is going to look at them and just make sure that they look okay. So I would encourage you to ask. I'm assuming that you're going to get them as soon as they're submitted. But if you don't, certainly I would ask for that. And you should feel free to ask right now, about your campus, your local campus planning, to see if there are any things that you can contribute or that you have questions about. So that's what I know. But we will all know a whole lot more around August 3rd than we know today.
It is getting a little late in the day, and I think one source of concern, more than specific details, is the fact that we're now mid-July. You're mentioning August the 3rd. Well, classes will be beginning around the 4th week of August, around August 24th. And for faculty who aren't even sure whether they're teaching online or HighFlex, that's pretty late. And
my understanding is that all faculty should know the academic schedule is set. That part is done from what I understand. So it may be there's a little bit of a lag in time, but they are, because that was the only way we could advertise to students so that they could enroll in classes, because we couldn't tell them what was online and on ground and hybrid and LRON and all the other words that we're using to describe our courses. So I would be surprised if there are faculty at this point that don't know yet. The only school that might not, David, is yours, because they were working so hard on figuring out how much HighFlex they could do. But my understanding is that all the schedules have been set and faculty know what they're teaching. But I agree with you if they don't. And again, it's going to take some prep. Either way, no matter what you got, you have some prep to do. I just got a quick question from Bill just to answer the 65 question, which I'll do real quickly. So the state has indicated that 65 is not in and of itself a debilitating feature. And so in order to get an accommodation for 65, you have to have a comorbidity. You have to have some additional reason that you can't come to work. So and we're going to have people, understandably, I'm sure as well, who actually have comorbidities and are over 65 and are still going to barrel through that door and tell us that we can't stop them from being on ground. So we're going to have to manage both of those. But 65 in and of itself is not a qualifying characteristic. So. Okay,
are there any other questions? If not, I'd like to thank Alice, and
welcome.
It's obviously an unusual situation, and it's a difficult one for all of us. I think that, faculty will be insisting on, more stringent measures of detection and prevention than the minimum, which would be the state guidance, especially because, we're institutions of public higher education, and there are higher standards, I think, that we should be expecting of ourselves. So as we see these plans come in, we're going to try and keep track of them here at the Faculty Advisory Committee as well, and let you folks know, as we see problems.
I will say, I again, and I do not work for them, but the Department of Public Health would never say that this is the floor. This is their guidance. This is what they think are the best practices. So, we might call them something else, but they do not see these as the floor. They see these as the best guidance at the moment, given the circumstances. So I just want to be clear that they didn't give us 3 options and we took the bottom. This is what they think is the right strategy at the moment. So you can fight the public health fight if you like, but I just don't want you to think that they're lowballing it.
Okay.
Yeah, because they won't let me lowball it. When I want to, they fight. 14 days of quarantine. I tried to get 10. Doesn't work. Yeah, Bill. Sorry, last thing.
I just thank you. That's important information to have about age. I would just like to make a comment on that for the record. That the issue with age is not that one will contract coronavirus more easily, but that the severity of the disease is much more likely. And so age is a tremendous risk factor for a very poor outcome with coronavirus. And I think that needs to be reconsidered. I think that is a real disservice to our community not to acknowledge the potential for severe disease among older people.
Yeah, that's the state agency review of that, not public health. But
I understand, and I know that there are a lot of misunderstandings. For example, the misunderstanding about masks, that masks are just there to protect to keep one from transmitting disease. But we know that's not true.
Right.
We know that people who deal with infectious disease always put a mask on. We know that morticians put masks on. They're not worried about transmitting the disease to a dead person, right? And so we understand that masks do protect the wearer as well. And so I think we have to be very, very smart about this. I think a lot of work has gone into it. I think there's a lot of sincere effort, but I do think we're still a little bit off the mark.
Yeah. And there's lots of concerns. So I understand, lots of concerns. And I don't know if any of the chats were for me, but if they were, Klein or David, please, I'm happy to take other questions after, not today, so you guys can get to your agenda. But
okay, well, thank you very much for coming.
Thank you all very much for your feedback and concerns. I appreciate hearing them. Thanks.
Thank you.
Okay.
Thank you.
Bye now. Okay, so I think that allowed us to air some questions. Not all, but certainly some. And I do appreciate the fact that Alice did volunteer to come. I'm sure she's had many meetings of this sort, but we have to be extremely vigilant, I think, and I know that all of you are thinking the same thing in terms of making sure that locally measures are taken which are sufficient to protect the students, the faculty, and the staff. Are there any more comments about this? If not, we can proceed to the next item on the agenda, which is, I think we've now sort of established as a report from the chair and a report from the vice chair. Since we've already spent an hour and a quarter on this one item, I'm going to make my report very, very short and very brief. I'm going to send along
Could I make one comment?
Yes.
This is Barbara about the discussion we just had.
Oh, yes, go ahead.
I think the decision by the system office, which I think is not a local campus decision, but is a system decision to not consider age a factor in accommodations, is really awful and will drive a lot of people directly into retirement for fear of their life. And I really also don't appreciate every single thing being done at whatever the minimum requirement or the minimum guideline is, and nothing beyond that to protect our people.
I see Bill nodding his head in approval. Yeah, and at CCSU, I mean, I don't know if Fred Latour is still here, but we had a discussion at the steering committee, and the question of faculty preference. I mean, they did it at UConn up to approximately 80% satisfaction. And that was reported at that legislative panel that was held on Thursday. I don't know that that's been done at the universities in any consistent way. Maybe it's been done in one school, but not in another. And I don't know what the situation is at the community colleges. But that is obviously a source of considerable stress.
I'm still here.
So
I was, pardon me, I was particularly interested in requirement of filling out an FMLA type form to continue to teach remotely, and whether that was common across the system, because it has been suggested at Eastern, and there is a form that they modified, the leave of absence form. And the form keeps on talking about leave of absence, and that you had to take the form to adopt it, have it completed. Is that happening in other campuses? Anyone hear of that in other campuses? Francis said it isn't happening at Tunsis. It's not happening at ACC.
So
As Beth said.
This is Jen Long. So if you do FMLA, you know, you can do that if you meet the criteria, but after you use up your sick time, I know this just from pregnancy related stuff, you end up just not getting paid. What you really want to do is use your accommodations through an ADA request and then get your doctor to provide supporting documentation. That's the way to just sort of say, I'd like to telework and I'd like to teach online via the ADA request. FMLA isn't going to necessarily protect your wages.
Right. I mean, it's problematic anyway. And I was bringing in the chat the notion of faculty freedom to choose their teaching modality. Has there been restrictions on campuses for that? I remember that we heard last month that the public health department at Southern is completely teaching online. That's true, right? So how was that decision made, and was there pushback from your local administration on that?
Well, that is true, first of all. There was only a little bit of pushback, but we had scheduled all of our courses online very, very early on, seeing this come down the line. I think the concern is not just whether you are teaching online, but whether you're coming onto campus, right? So if you're teaching all of your courses online, and if your department meetings and the meetings of committees that you participate in are online, the only other thing that you'd have to come online for would be to advise students, or to hold office hours rather. But as we did in the spring, many of us very successfully held office hours online. The question is, could someone say, I'm just not coming onto campus this semester, and do that without getting approval locally? And I think that's being worked out differently on every campus. And I think some administrations are being more stringent than others.
Yeah, which I think is a violation of our rights as faculty, that we're being treated differently on different campuses. Yeah, well, I don't want to belabor it, but I just was interested. It doesn't sound like our campus, which wanted to be 60% on ground and 40% online, the faculty were about ready to have a revolt, because it's hard to do the kinds of teaching they're expecting us to do, given the facilities we have, if we're going to do it online, on campus.
And this issue came up repeatedly. This is Jen Long on my campus, and just in we have like a water cooler chat discussion on Blackboard about it. And the issue, like I said at the beginning of the meeting, is that they're not processing the ADA requests in a timely manner. Also, some people submitted theirs a while ago, and the answer is, oh, we're backlogged with so many requests. So that doesn't seem reasonable. It seems like they should be supporting that office more if there are a lot of requests. So I just want to make that point again, because I do think that when people realize that 65 and older isn't going to get you out of going on campus, potentially people are going to be filing when they realize that, like September, October, and they might not get to their request until by the time the spring semester schedule is set.
I know we spent too much time on this, and it'll all be resolved in a couple of weeks. They're clear, and we joke as faculty on our campus that they may open, but they'll close the next day. So this is a lot of worry over nothing, because it's just not feasible to do what they want to do. Remote teaching is feasible, not populating campuses.
Bill?
David, I think your thinking on this is clear and going in the right direction. The incidence of coronavirus in Connecticut is going up. We're still below a threshold. We're at a very, very low level right now, but we're moving in the other direction. And we're kind of, we're surrounded in a sense. I mean, nationally, we see what's happening. We are now at rates of occurrence that are higher than ever before, when New York was the epicenter and when Connecticut was very hard hit. And the disease has not changed. It was our behavior that changed the situation, and we're going back to the old behaviors. And what would we expect to happen, right? And so I think, I don't know what's going to happen. I don't have a crystal ball. I've been looking on Amazon for one because I need one. But I think an educated person can guess that that very quickly we are going to revert to an all-line situation for this fall, or at least at some point. But I think everybody understands that there is a financial element here. There is, I think our administrations are very eager to get students back on campus to try to present some semblance of normalcy. And I don't think that they are intentionally trying to risk our lives, but I think the end result is, for some of us, that's what's happening. So I hope the faculty will stay together and be very clear and loud with its position on this.
This is Barbara again. I'm pretty alarmed by all of that discussion that we had. I think it's very dangerous for people. We'll be seeing a lot of sick students and faculty and staff. I was wondering if we might want to consider maybe having a special meeting sooner than we would have, and maybe inviting union people, or at least checking with them first, because I don't think this should just go forward unopposed.
I can weigh in just briefly. On our campus, we've had a couple of union meetings in the last month, and this issue has been front and center, particularly for the staff, because the staff have been brought back on campus, some of them already. And we actually put in a statement out to our administration in which we, using some of what we talked about here, made the point that really people should only be on campus if they absolutely need to be on campus, to the extent that they need to be, and for only as long as they need to be. And I think that's completely fallen on deaf ears. The union's position simply seems to be work with your supervisor, and if you can't work out an accommodation, file the appropriate paperwork. That seems to be their position, unfortunately, and that's a very weak position. And to follow up with what Barbara said, that's completely unacceptable to me.
All right, this is Lois Amy. The 4C is having a delegate assembly meeting tomorrow, and this is on the agenda.
Good.
And also, I do have a comment that I want to get out there that I think that it was very obvious that Alice Pritchard wasn't paying any attention to what we were saying. She wasn't taking any notes. She wasn't doing anything. So I think we need to be very vigilant about what's going on, because she's obviously not going to go back to anybody and say, oh, faculty advisory committee were concerned about these items, because she wasn't writing down a thing.
Are there other comments? Yeah, I think we need to watch this. I mean, speaking at the situation at Central, again, it's all we only have, you know, that amount of information from our departments and maybe from our schools and barely from the university as a whole, because as Alice herself admitted, Central hasn't yet indicated to faculty whether they're going to be required to teach high flex or to be online. And so the attitude of administrators that I've seen, at least the dean for my school, is, okay, he's going to make some recommendations to the provost is going to make some decisions. If you don't like the decisions, go speak to HR. And I know that the two unions, the AUP and the SWAF union, are both reasonably upset at Central about the perfunctory way in which faculty preferences and faculty needs are being, and staff needs for that matter, are not being taken into account. So, I mean, there's a union dimension to this, and there's the faculty advisory committee. What I'd like to do is to send to everybody a questionnaire, which I'm just going to show you very quickly, so that I can get an idea for the different schools. If you can see this on your screen, I want to send it after the meeting. Questions about teaching faculty, just briefly, but are you being informed of the plan? Have you been consulted about your preference? Are you fully informed who's been designated for each type of teaching? And again, for administrative faculty and staff, are you fully informed of the plan? Have you been consulted on your preference? And do you know who has been designated for each type and frequency of presence? And then some more general questions, or some more specific ones, about testing of residential students, testing of commuter students, testing of faculty and staff, distribution of face masks. In other words, are you satisfied with the procedure that you know about at your campus? If there is no procedure has been made public, then mark no. And what I would like to do is, if I can get this from all of the community colleges and the universities, tabulate it and indicate to those people with whom we are in contact in the legislature, on the board, in the executive of the state, what are the dissatisfactions of faculty and staff at the present time. So I agree, we should not leave it at the point, well, we had a discussion with Alice Pritchard. It's nice that she came, and that's true. And I think she, is used to coming to these kinds of meetings and all sorts of meetings. I understand for administrators, life is a series of meetings. But we're not satisfied. But I do need to have more specific information about each campus. So would that be agreeable to everybody that I send along? It's just it'll be an attachment to Word document. Just put X in the box, which applies. And I'll tabulate it by Sunday and let everybody have the results. That would be my report.
So one of the,
This is Barbara, guys. I think that's, oh, go ahead.
I just wanted to ask about the survey. This is Myrna. I wanted to ask about the survey as we're representing the whole system.
Right.
When you fill this out, I'm going to need more time to run it by some of the constituency, because I know what I know and I know how our union is operating. So should I just respond
Yes.
accordingly?
I'm asking for individual responses. You don't have to bring this back to your
Okay.
constituencies.
Thank you. Sorry, Barbara.
Yeah, I want to return to the question of a special meeting, because if I'm looking through my calendar right now, and I don't think we meet again until maybe the 28th of August. Is that possible?
I think that's true.
Yeah.
We can't possibly respond to this by meeting then, after classes have begun. I would think early August would be a time that we should see whether we want to make a big statement or what we want to do at that point.
I agree.
I was thinking August 7th. That would be 3 weeks between this one and the next.
August 7th, a special meeting?
That sound okay?
All right, do we need a motion for that?
Probably.
Okay, let me see.
I would move it for the 7th.
All right, 1 second, let me see if I can remember where I find the voting thing. Oh, good grief. Oh, yes.
So this might be something where we could ask if anyone's opposed.
Yes, let's do it just by voice vote. Those who are in favor of having a special meeting on August 7th, specifically on the reopening procedures.
Aye.
Aye.
Those in favor, aye. Those opposed? Are there any abstentions? All right, I'll call that as a unanimous vote in favor, and we will do that on August the 7th. Is that a Friday, I hope? So, Colleen, I didn't check. Okay, Friday, August the 7th.
Mhm.
All right, Colleen, it's your ball is in your court.
Yay. Okay. I'll try to be really quick because actually this month we've only had one BOR meeting and none of the committee meetings in between, so there's not a lot to say. However, and there was an executive committee meeting yesterday, but that was uneventful. I did send you all a letter that I intend to send to Dr. Harris, Dr. Levinson, and Dr. Gates. And I would just ask, I don't think we have time to really discuss it much, but I would ask that if you are sort of sympathetic with moving this forward, what happened was I shared it with a few people, kind of expecting them to talk me out of sending it. And what I found instead is that it's being shared with quite a few other folks who are doing work in this area across the campus and just who sympathize with that message. And what's really, I think, interesting is that we're kind of getting a group together who want to talk about the issue and actually get something done. What was striking, I think, about the article in the Mirror, I think I said it was the Current in the email by accident, but what was striking about the article in the Mirror is that it appears that the impression at system office is that this job of anti-racism is already complete. And many of us believe that that is actually not the case, but it would be wonderful to start that conversation and really start working together on what we might see as moving in that kind of direction. So if you'd like to share it with anyone, feel free to share the version I sent you, or I have another one that actually has the supporting documents for those who are not aware of the context of that communication. And I will also just mention that as the person representing the community colleges on the board, this was not kind of the relationship I wanted to have with the board, and I just want to express that to you, that I'm not pursuing this sort of more combative kind of communication with them, but it just worked out that way. And hopefully we'll start moving in a better direction. It is harder, I will say, because David and I have been doing this now via WebEx only, and with no video even. So it's very hard to develop the sorts of relationships that would make these sorts of difficult conversations a little more palatable. So I hope that changes, and I hope that moves in that direction. So if you have any comments or anything, I guess maybe after the fact you can email me or whatever. But please do share it with folks who could really participate. That's it.
Okay. I can certainly second your point that it is a little difficult to establish relationships and to have, for that matter, any impact in a remote meeting, which is voice only. Because being able to actually see people makes a slight difference. I mean, I think it makes actually a significant difference. And their enforcement of voice only doesn't make any sense to me, but it certainly, I can see that it does enable the people who are chairing the meeting to chair it the way they want. It places us in a more subordinate position. There's a power relationship that's going on there. I've had no contact whatever with the president of the CSCU or the chair of the board, other than one time after I asked President Ojeki a question about the salaries for the interim executive for the one community college. At the end of it, I said his response, which he did give the figures. I said thank you, and he said you're welcome. That's my sum total exchange with him, which is I'm a kind of a garrulous guy, as you may have noticed. Philosophers tend to be chatty. It's a difficult situation, but we'll muddle through. And I think having a meeting on August the 7th, that's an excellent idea, so that we can still have 2 or almost 3 weeks before classes fully begin, if we have further points that we want to make, and we have to do it forcefully. Okay. The item 6 on the agenda is the NESHE joint update, which I imagine everybody has seen already. I don't know if there's any further comments. What we did is we've asked for the complete text of NESHE's response to the progress report that was made, and as you know, apparently there is no such document. Let me just share with you, if you haven't seen it already, just to remind you of what they had to say. And I thought it was particularly disrespectful of us, in the sense that, especially here, the commission was also in receipt of public comment documentation, both affirming and identifying concerns with the effort, right, as if they were equally balanced. Consistent with commission policy, President Lujakin responded to the public comments. The commission voted to take no further action on the comments and will thank the commenters. I thought that was rather perfunctory, but we have made a request, and so far as I know, the document has not yet been distributed. Now, maybe Kalina, you have something further to add to that, or something?
No, only that at the executive committee meeting yesterday, Mr. Ojeki did say that that the comments or in opposition to Students First had been dismissed by NECHI. That's kind of the way that he put it, that they were just they considered the matter closed, and that was that. So I am interested in seeing the full report, especially since the response that he provided them did not actually address any of the issues raised in those comments, and in fact made some interesting statements about other, they took up the issue of whether or not something of this scale is unprecedented, and it was just a bizarre sort of response. But yeah, that is what he said. And also David Levinson was interested in coming to chat with us, and is hoping that we'd have the full report in time for the 29th, the August 29th meeting. And if it is, then he will be here to talk about it, if we'd like that.
Okay, are there other comments about the NESHE report? I mean, if not, we'll wait to get the full report, and with some expectation that for the 29th, the regular meeting on the 29th, we'll have that discussion, including Levinson, if he is so interested.
This is Lois. Did I just add that I thought it was very, very impressive that NECHI was so impressed with the fact that they came up with a name for this college?
Yes, it looks like they ticked off the boxes. They came up with a name, they came up with an interim executive, they came up with a 15-page organizational chart, and that's, at least from the joint statement that is made, seems to have satisfied them, at least for the year.
Yes, I think that's all.
Other comments? All right, let's move on to number 7, which is college resolutions. Colina, I think that's you.
Is Mike here?
Mike Shea?
Yes,
Mike Emanuel, sorry.
yes,
Mike
yeah, I'm here, Mike Emanuel. Yeah,
Mike had shared with us
hold on.
from Northwestern, so you can take it, Mike.
I didn't quite hear it. I had some trouble with the signal. Say it again, please. Repeat it.
He said that this resolution that we have, and I think that we need to gather some other resolutions. I think we let some pass because I know there are at least 3 or 4 other colleges who have passed resolutions in response to the org chart, but I don't know that we have received and registered them. So we'll have to remember to do that in the next meeting. But for now, we have one from Northwestern that will that addresses the org chart. So if you could just sort of present it, Mike, that would be great. And then we'll make sure to include it with the minutes so that it's on record somewhere.
And when do you want this to happen, or when you?
We have it, so we'll include minutes.
Yeah,
but
you want me to present it at a BOR meeting? I didn't quite. I apologize.
just-
I'm in a car and it's cutting in and out.
You can just briefly describe its contents. I'm looking for it right now. If you'd like me to
Oh,
do it, I just
yeah,
find it.
I don't.
Just a quick
Well, I
summary.
can tell you. Yeah, I can tell you that when I complimented Sharon Gusky, who's our pro Senate president, about the document, she said I can't really take credit for it because she took it from the basis of it from other community colleges. So there has to be similar documents or something close in the system as well. So, but I think it encapsulated all of our concerns very well.
Well, thanks. And we'll make sure to include it with the minutes.
Okay. Sounds good.
Okay, are there further discussion on college resolutions? If not, let's pass on to item 8, which is College and Career Success Course. Again, that's Colina.
Give me 1 second to close my door. I'll be too low. Here I am. All right, so I shared with you all the document, and it's so late that I don't want to go through it in too much detail. I did ask that some of you give some input, especially on point 9, and Jen actually wrote something up and sent it and actually expanded it. I just wasn't sure whether my critique of it was fair. I do want to just very quickly mention all the points, if that's okay. So this is there's a document here that it's CCS 101 as a case study in the flaws of students first, because it really does seem that the process by which CCS 101 came about and its content are really representative of many of the things that people oppose about students first. And it is also a course that will be required of every student in every program, right? So it is consequential. And it is something about which all of the student SFA, SACC work groups have had a lot to say. And what they had to say has been purposefully subverted. So this is a write-up that could serve in a couple different ways. One, it could just document what happened. The other is that it could be provided to NETRI as a follow-up to our comments. Then again, we did hear that they're not going to make much of the comments. I don't know if that's true, but it is worth having on record. Okay, so the various points. The first is that that shared governance and curricular bodies actually rejected this course, and they rejected it pretty emphatically. I know at Gateway, things got quite heated. There was some yelling when the Guided Pathways folks came to try to kind of talk us into it. Then there's point 2, working together in bad faith. Now, this is the thing. So after it was removed from the first Gen Ed core, when it was circulated at the beginning of 2019, I believe it was, it was removed And then there was a note on there that said that Guided Pathways would take it straight to the board, even though it had been rejected by the Gen Ed group. And then when the Gen Ed group protested this, they took the note out and then assured them that it would be fine and that wouldn't happen, so that they would continue working. Okay, we know that it did happen. The Shared Governance Work Group was really worried about that because this is curriculum for the future college, and we have no curricular process for the future college up to now. So they developed some recommendations, and the response to those recommendations was that, well, we were actually specifically asked, even in our recommendations, to remove the point that referred to any course that didn't go through a curricular process, right? Because they knew we were talking about this course. We were asked specifically to remove that. And when we didn't, the folks were basically asked to resign, okay? Then at SFA, SACC also, there was an issue with this. So, so basically all the groups opposed this and made it clear that they didn't want this to happen. When this went through the board, no faculty knew that it was happening, and it had gone through no curricular process. It also purposefully undermines the Gen Ed group in two ways. So I want to add one more point to the to point 3, if you don't propose it. It's basically a Gen Ed course that has been forced in against the will of the group. But the second point is that the Gen Ed group asked for a diversity requirement. And what they did was, in effect, take away the diversity requirement by deciding that this course that has no outcomes related to diversity would satisfy the diversity requirement. Okay, so it undermines their work in two ways. So I would just put in an extra sentence about that. Illusion of inclusion, co-opting the voices of faculty and staff. Point 5, prioritizes the input of paid consultants and others outside of our college system to the exclusion of our own faculty, staff, and graduate students. 6, absence or misuse of evidence. 7, lack of oversight from the BOR on both academic and financial implications. 8, dictates course outcomes. The BOR dictates course outcomes. 9, the adequacy of proposed strategies is questionable. And how do I share with you the addition that Jen provided? I will see in a second. 10, pays lip service to commitments of students of color, commitments to students of color. 11, haste takes precedence over quality of product. So those are the general categories. I hope you all read it. And there's just the addition that Jen has added. Okay, so those are the topics. Any comments on this?
This is Jen. I think it looks great. And so for the comments that I added, I would definitely want to wordsmith them with you because I was just sort of, I wanted to respond to the piece about, why students aren't passing those entry level courses. And so I'd have to think more about that. But I could share my screen and show you the email. If you wanted to pull up the email, that would be the only other way. So
yeah, I'm not sharing the screen. So David,
I can stop sharing here,
and Jen, you share because I'm not on my laptop. I have it separate.
Okay. So it's, sorry, I have so many things up. Can you tell I'm going to read online? Okay. Oh, so it's everything in blue there. Let me just move you guys.
And that would just be added to what's already with point 9.
Yeah, so this was point 9, and so it said the problem presented students failing Gateway Math and English courses. In fact, 60% of our students enter their college course requiring some remedial math, reading or writing instruction. And so what I wrote in blue, so I'll just leave that so you guys can read it. unless you want me to read it aloud. I don't know what you prefer.
Well, we're not approving it, I don't think, at this point. So,
No, I just wanted to show you, like, just adding what the details were, but
yeah, and if you could send a copy to, Kalina, you have a copy? So you can send all of us a second version with Jen's additions.
mhm.
But, you know, as a somewhat outside observer, it strikes me that this confounds first-year experience, remedial courses, diversity, career and academic planning, and advising, all mushed up together in one thing, one 3-credit course. It's a universal Band-Aid.
This is Barbara. I've been thinking again about future meetings, and I'm a little, more than a little, confused about what is the current role of David Levinson and Michael Rook as interim community college. But I wonder if we would like to maybe invite both of them to talk about whether they have any power, whether there is any plan to have an actual curriculum process in the one community, the interim org chart, or what's going on about, are we going to get any governance at all, any curriculum involvement by faculty as these things develop, and with the story of this course as an example of what's wrong.
Well, I'll say this, if this goes to NECHI, and again, I have no idea whether that's even useful. We should approve some portion of it today, because it would need to get to them by the 24th for their next meeting. Then again, maybe we don't rush and we don't care because they don't seem to care anyway. So, okay. And Barbara, are you thinking in terms of having that conversation on the 29th, or do you want to have it sooner than that?
No,
Like
not sooner. And I'd be happy to approve your thing today so it could go to NECHI, but I think they've now supposedly shifted some responsibility to these people who are not Marco Jakian and Alice. So is this really to ask them, you know, are you just pretending, or is there something real here? And if there's something real, then are there some things we need to talk to you about?
Right.
Yeah. Personally, I think that's
So
the
I wouldn't.
strategy.
Not the special meeting, but maybe the 29th or maybe the one after. Whatever people think.
Right. Well, I know Levinson has been really he would like to keep the lines of communication open. Maybe we can prepare questions in advance of that meeting on the 29th.
I had another
I think
thought.
maybe send that. Go ahead.
In addition to NECHI, and I think this should go to NECHI for whatever good that does, you know, maybe this should also go to the AAUP Committee on Governance. Maybe they would take an interest in this, because I think it's the most egregious example we have of violation of shared governance, and it's well documented.
Okay.
And perhaps that would move them to take an interest in what's going on, at least give us some advice.
Mm-hmm. That would make sense, actually. You're right, because it's fairly straightforward. Yes. Yeah, and I should say, this is only half of the CCS 101 report. I'm doing the destructive part, but Jen, Mike, Ron, and I met earlier this week to talk about what we can do just to, as much as we dislike the existence of this course, maybe advise in productive ways about how it can be improved, or what kinds of parameters should be set. And it's weird what we're proposing, I think, but when you consider the fact that we're building curriculum without any faculty body input and no curriculum committee, it seems like that's why we're getting ourselves involved in this. So once we decide what we can do with this document, then Jen can tell you what we're going to do, or what we'd like to do to at least try to make it workable if we do move forward in this direction, which it seems that we are. Yeah.
Did you want me to
two
put that out?
questions. Will this be received as a report? Will it be forwarded to AAUP? And will it be forwarded to NECHI with the understanding that we will add the content of what Jen has added here, but just minor edits and wordsmithing? If we are comfortable with the content, then we should, I think, make those decisions.
So I'll stop sharing so we can pull back up your original document, because I'm sure everyone's had a chance to read my brief.
I move the motion.
Okay.
I'll second.
Okay.
All right, further discussion?
Yeah, this is Lois. I have a question. I'm not sure what the point of sending this to NECHI is and what context you would send it.
How about sending it to AUP National?
Oh, this is AUP.
No, but this is, well, I move the motion. I think that we should send it to NECHI because I think drip by drip will torture them. They don't care. But if we don't keep on biting, they will forget about it.
Yeah.
They'll forget about us as they have already. But I think it could be a national issue because it's a clear violation of shared governance and faculty involvement in curriculum development.
Right, but I'm not understanding what the context is and what you think that NECHI would do about this.
You're very muffled, Lois.
I don't have my headset with me, so.
Okay.
I'm not understanding what the context would be to send to NECHI and what you think NECHI would do with this, or what you would like NECHI to do with it.
Well, so that's a good question. I know that I would have included it in the full FAC comments that were sent before as an example of violations of shared governance. There's also this little note at the bottom that asks us to satisfy NECHI standard 4.5 while asking us to satisfy several different outcomes that are incompatible possibly with each other. However, so I felt like it was a good follow-up. And so I was wondering whether they would need this, but I am not seeing that they particularly care, and I would defer to you, Lois, on matters of NECHI. So,
well, I want to go back because our public comment did actually cite two places where we had been mandated. First of all, the pass-fail credit non-credit thing that was mandated to us in the system office. And the second one was the self-reported GPAs for registration purposes. So, and those were in that public comment that we sent, and they obviously are going to ignore that and dismiss it.
yeah, but actually, if you notice, Jakian's response to that was that your comments had confused emergency responses to COVID with consolidation curricular processes.
Understood.
That was his response.
Yes, understood his response that we were confused, but the next is not questioning it.
To David's point, though, what we're really trying to do, I think, is two things at a minimum: to document what's going on, even if it's for posterity, and to hopefully get NECHI to do its job, quite frankly. Maybe at some point, something will move them to actually take this seriously and do their job.
I think we also have to think in terms of the fact that the people who participate, you know, on these NECHI commissions or whatever, they are involved in various different systems, various different states. And if we document these standards and they accept it anyway, so they are in receipt of it, they're setting a precedent that I think very few of them really want to have to live with. So if not, just for that reason, just put it out there, like put them at risk, right? Even if we don't get saved, it might get them there.
And two, since you've done the work and it's a wonderful summary, we should make use of it as best we can.
And we'll definitely use it. I think AAUP, it really is appropriate for that. So thank you for that idea. And then, yeah, so.
Right, well, there is a motion on the floor. I am looking for the polling thing and it has disappeared, I'm sad to say. So I'm afraid we would have to do it unless there's an objection by voice vote.
That's fine with me.
Is there any further discussion? If not, those in favor of adopting the motion, and the motion is to forward this to AAUP, is that correct?
And Neshi, I believe it's
And
both.
Neshi.
Right.
Okay, both. All right, those in favor say aye.
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 Aye. Those
Aye.
opposed, nay. Abstentions? All right, well, that's approved. So thank you, Kalina. And that is a well-documented, I think it is important to continue to document it. I don't have much faith that, or confidence that Neshi is going to take this into any real consideration. But I think that it does establish a basis for example, a letter to AAUP. That would be, I think, probably more useful at this point, at any rate.
And let's not forget, so Jen, do you want to present what we're going to try to do in terms of moving in a positive direction with this thing?
Sure. So, sorry, computer issue. We were thinking, we were thinking about inviting the folks who are designing the curriculum for the new course to a meeting and asking them questions about their course design, thoughtful questions that we could generate that would get to the heart of some of the issues that we have. And we thought if we brought the actual teachers into the discussion that we might have some influence, since the folks in charge aren't really entertaining in many of our thoughts. Is that a good synopsis? Yeah.
Who is, sorry, this is Mary Beth. Who do we know who is actually designing this course at this point? Are they people who are on loan to System Office from campuses, or?
I think so. I think there's a group that was formed. Well, in the meeting, we talked about how there was a group who was formed, but that also that we didn't want to do any consolidation work. So we didn't want our comments to be necessarily used in that way. We wanted to have an opportunity to have the folks who were doing the work think more broadly about some of the implications. So it was really an opportunity to have a thoughtful discussion. And I know at Three Rivers, for example, there's someone who's working course, but I don't know if she's on the larger group or not. So I think it's a little bit blurry, and I don't know if we want to invite them as that consolidation group working on the course, or if we want to invite someone from each college who might have had a say on it. So a lot of stuff is up for discussion, and also the types of questions that we might want to generate to ask them would also be something that we were hoping we could do today with you all. Colina, do you remember the name of the group?
It was the HSSUR group, Holistic Student Supports and Holistic Student Supports and Redesign group of Guided Pathways. Yeah, but if you actually look at the report, there's very little information that was gained from our experience with. So it would be interesting to hear what they would say. Some of them, anyway. And I know it's. Does anyone feel capable of generating this list of questions today? Would you prefer to send via email when you have a chance to kind of reflect, or? though I'm kind of afraid we won't get responses. Are there any immediate questions?
Well, I suppose we would first have to think about how to approach them and what the tone would be, and be really clear on who our audience is. And we would have to decide whether we wanted to ask them for any work that they're doing in advance so we could review, to have other thoughtful questions, or if we just wanted them to show up and have it more of an informal conversation. And as they presented to us, where we're seeing the content for the first time, anticipate what they're going to be presenting. But we first have to make sure we get them in the room, so to speak, right? So I think that the idea would be to make sure that we could ask questions like, who are the types of people who will be, what would be the background of the people who are teaching the course? And, can you give us an idea of what the outcomes are going to look like? And what type of expertise would you need to really meet those outcomes well? And what were you envisioning in the type of teacher who would be able to manage these things? And how are you assessing writing? And will someone who's designing the course have a background in writing assessment? And will you be using common rubrics and writing assessment tools? And how will you negotiate having developmental students in a college level class in terms of writing? So those are the kinds of, just if I had to think of things off the top of my head, those are the questions I would probably start with. And if there are other deeper things that we want to get out of the discussion, it would probably be better to just talk it out before the time comes, so that we're no one's feeling attacked, we're not wasting anyone's time, that kind of thing. So personally, I guess, how do you all feel about the idea of having kind of a teacher talk with the people designing the curriculum as a strategy to have some type of influence?
So can I just clarify this to Alice? So what we're doing, people can say that if they give us an explanation that satisfies us, we will support this course. Is that what you're doing?
I don't think, not necessarily. I think it would be, the goal would be to say that we could sit here as a body and generate a ton of questions and comments that we could send to the people in charge. And if they're going to disregard them, as they seem to disregard most of what we send, then there won't be any true outcome of that work. It will just be spinning our wheels. But if maybe we could say teacher to teacher, how and why are you doing what you're doing? It might give them pause for them to go back to the people in charge and say, on further reflection, this does seem a little bit challenging. These are the things that we might face. So really, it's not, the ideas are coming from us, but it will be better received. So it's kind of like, because we started the conversation saying, who could we bring to the table who would listen to us? And then we talked about how several of those people would come and act like they're listening to us, but not actually listen to us. And so it would just kind of, what sprang out of that was an idea of more like a teacher talk. And we would also get to see, I would anticipate that the folks who would show up would say that they felt a little put on the spot, that they were handpicked, that they didn't really kind of know what they were doing, and that they were a little overwhelmed. And then we could have an opportunity to talk about what that process was like. So I think it could be a positive conversation that could lead to something that could be helpful, because I feel like otherwise Kalina sort of asked the question, like, should we bother doing this if our audience will be unreceptive? So this is a workaround to that to some extent.
Well, I guess I'm still not understanding, but I'm guessing the bottom line to this is that at some level that we want to reach a point where we're going to accept this course if we agree with how it's created and its outcomes, etc.
I think, well, Kalina could probably speak to that more. I just brought up my points to sort of say, how can we engage in a real dialogue? I think that's what the FAC is longing to do, is to engage in real dialogue about some of these things. So we could make it clear that we're not interested in the course at all, and I think that is pretty clear. But if it is being constructed, then I think maybe we'll be less vilified if we explain to people why we're being so constructive in our criticisms. And the whole idea of why we're being so constructive in our criticism is because we're really thoughtful of what we do, which is why faculty input is so important, right? So I guess I'll stop there.
And I can say also, Lois, because I think what you said was something about it's almost like we're acknowledging this thing, right? So I think to the extent that we acknowledge the org chart as a thing that is in our foreseeable future, and we write a resolution in response to that, we acknowledge it to that extent. When we got together, we were thinking about this in terms of, do we write a resolution? Do we offer recommendations, or should they be high level? Should they be detailed? Should they, like, what should they actually be? And then, and the question was how to address it in a way that would in any way at least begin to create some sort of solution if this thing is in our future. What I do find very interesting, though, if we do ask people to attend, is that when you look at the list of names, of faculty names from the colleges with that report, I don't know that any of them know what this course is. I don't think they were informed that it was brought to the board. I don't think they were provided with the final version of the proposal. I was speaking to someone who actually wants to participate with me in these talks about how to make the thing more anti-racist, and she was expressing outrage at the fact that this ended up in this course. And I said, you do know that your name is attached to it, right? And she went, ha! So, you know, this is kind of where it is. So I think it would just be very interesting to speak to these people, because I do find it really, it's serious that this speaks very much to one's own professional integrity. There are people on that list who are good people, who do good work, who would take it very seriously that they have been, it is at least implied that they have endorsed something that really doesn't seem viable and might want very much to be part of a process that can at least begin to undo. I don't think there's a lot you can do with the course as is, like something has to give.
Cone, you know, we have an oversight function, so I think the place to start is what Jen was doing, and that's a series of questions, and then invite answers, and that begins your dialogue. And from there, you know, perhaps you can, if this course is going to come to be, help these people create a course that has some focus, that has some value. It's not to say we're committing to the course. It's not to say in the end, if the questions aren't answered satisfactorily, we don't pass a resolution objecting to it.
Well, would it make sense to bring this back at the meeting on the 29th? Or even as a second item on the meeting for the 7th as continuing business? But that would give you, if we did it at the 7th as a second item, that would give you some time to work on the additions, Jen, that you want to make, and then finalize a strategy and a policy.
And please, I mean, I think the more diverse, right? I think this is what you were getting at, Jen, and the reason that we brought it here is that the more diverse a group that we have providing questions, the better. Like Jen knows a lot about this, and they've actually test run a lot of it at Three Rivers, so she's got a lot of great questions. But there might, you know, there might be more. So just, and you know, Mike, who has had experience with a good version of this, also had some really valuable stuff. So please send questions or think about them deeply.
To both Kalina and Jen, is that correct?
Just to clarify, we're sending you guys we're going to email questions to both of you. I had to step away for a second.
Or think about them in preparation for August 2nd, it's August 7th, since it's a second item on that agenda. Either or.
Okay, so we're not inviting though. We're going to do the invitation after the 7th. We're going to use the 7th to regroup and okay. Thank you.
Okay, good. There's one last item on the agenda. I think, Steve Marcellinus, are you still here?
I am still here.
Okay, good. We could have kept you until after 4, but we too would like to finish before 4. So let me just share the screen. You sent us an email, and let me just share the screen here. And perhaps you can introduce the question that you have for us about a TAP coordinating council membership. Go ahead, please.
Absolutely. So basically, months back, FERC has set some recommendations to unify the transfer tickets, the Section B portion of the transfer tickets, which was up to individual campuses to select which competency they wanted to include in that. They decided to unify it or consolidate it to continued learning and information literacy and oral communication as those two areas that would be consistent amongst all the transfer tickets throughout all 12 community colleges. It was voted on by FERC and approved. Unfortunately, the curriculum change can't happen until it goes through a formal process. Part of that process is going through the TAP Coordinating Council, which essentially has been defunct. There's really no membership on it right now. So we're looking to revitalize that council. And as part of that, we need 6 members from the Faculty Advisory Committee. So I'm here today to make that request and see who might want to serve as a member on that council.
All right, I'm showing on the screen, you sent us a PDF. This goes back to, well, it started off in 2014, but this is the charge of the TAP Coordinating Council, right? And its membership, which is the membership that you indicated, I believe,
Correct.
the email that you sent. I guess the point today would be to discuss, how do we see this and what procedures would we like to use? I'm not sure that we could actually provide you with the membership today if we agree. But first of all, let's see if we think this is a useful institution to adhere to, and then any comments that we have about the specifics of the election process. Has anybody here participated before in the transfer articulation?
Yes, I have. I was actually representing Steve Adair, and I were part of that council under the direction of Elsa Nunez and Levinson. Do you hear me?
Yes, we can hear you. Fine. Go ahead.
So I, if this body decides to move forward with representation, I'd like to serve on it as well, having the background in some of the TAP programs.
Okay.
This is Mirna, right? Correct. Sorry.
Yes, Mirna. Yes.
Yep,
why did this fall into suspension or into abeyance? Was there a problem with the organization of it?
What's that? I'm sorry, I didn't catch the question.
Yeah. Well, why was it in a sense suspended at some period of time, or not?
From what I heard, it was just lack of basically lack of meeting. From when I talked to Ken Kluchnik about this, he said that essentially the council didn't convene for years, and therefore the terms of the particular members ran out. So again, it was a little bit, I think, of a surprise to FERC when the recommendations were made, and then we kind of hit this holding pattern of, well, according to this document, we have to go through this process. And again, when I asked, well, so who's on the council, and Ken told me that it basically had to become revitalized.
So is Myrna the only one who's had experience on this on the council previously?
And Steve, remember Steve was the chair at the time, Steve Adair, so we can also talk to him if you needed further information. But it's news to me because I believe, and correct me if I'm wrong, Steve, but when Jane came on board, she then took over the role of either David or Elsa. I'm not sure which of the two, in terms of convening meetings with the group. And the only time the group would meet is if FERC would send along information that required the council to approve. And so if
Exactly.
and so if FERC never sent anything on to the council for any form of approval because their work may or may not have been done, I'm just wondering who made the decision to dismantle that group when the MOU is still kind of standing. You know, no, I never got a message, and I'd like to ask Steve if he ever got a message indicating that the group was no longer functional, and for what reasons.
This is Barbara. I can't remember if I actually was at a meeting of that late in the stage, but I have the impression that what happened with the transfer stuff was that Candace and Ken just started working on it, and a lot of decisions got made by them about how this was all the details being worked out. And I really appreciate having someone come and say, but there's supposed to be another oversight body, because I think there should be. The other thing is, I think Lauren Doninger, if we invited her to a meeting, she knows a lot about this.
Yeah, she actually co-chaired FERC for, actually back to the steering committee days, for years. I served on the steering committee in FERC also until 2 years ago. And I think you're right, Barbara. I think that's exactly what happened. It was essentially an informal process that emerged where FERC was really the driving force there. And Ken and Candace were doing the implementation. And it was essentially a workaround system that emerged that bypassed this other committee.
Sorry for asking this.
So
Is there urgent timing on this, or would it be possible to invite Lauren to help us understand what happened?
No, I would like to see the council kind of convened in early fall. So there's definitely time. I know you guys already discussed having another meeting, 2 more meetings before September.
Right,
so
right.
that should be, yeah, absolutely. Please discuss it. Lauren would be a great resource. Fran, I know you have a lot of history with FERC as well. And I think, Myrna, you're kind of, from what I'm hearing, you're kind of connecting a lot of the dots for me here, because I've been picking up a lot of different information as this has been going on. And it sounds like that's essentially what happened. Like you said, the council wouldn't convene unless asked to, but since some of these decisions were being made maybe elsewhere, that it wasn't going to the council, and therefore, again, membership kind of lapsed. So, and when I say membership lapsed, I just mean the term limit of the membership. So it's a 2-year term, and if it wasn't, that's all.
Okay. Well, look, I think
Can I ask one other question? Do we know if this council is reconvened, are the charges stated in the memorandum the same, or are the charges going to be different for the council?
For the most part, what I would like to focus in on is where are we with TAP now? That's, the idea of are we successful? Where can we make the tweaks and changes, and to have more of a voice, more of a consensus within the system would be ideal. So that's where I would like to see it. And then if adjustments to the implementation plan have to be made, then we could go about that moving forward as well. But it's really to see that, we've had these degrees in place for quite a while now. And I would like to have a more formal, more structured sense of how do we proceed to make sure that this is making the best impact for our students and everyone, all parties involved.
But this is Barbara. Again, just from talking with Lauren, I've had the sense that some of the curriculum committees that were working and probably the guided pathways people too wanted to move to having that this ties into curriculum issues too, that the TAP degrees were based on competencies, but the new standards for general education are more based on disciplines, that there's a big difference there. This is a very complicated issue about TAP.
Well, I think that's one of the reasons why FERC is so instrumental in this, is those recommendations were put forth to FERC, and FERC had the option to discuss and put forward a proposal for how to move forward. So with that, you have faculty from all 17 campuses in that discussion. I'll be honest, not all 17 campuses are participating in FERC, and that's but there is at least discussion. And again, if changes are made, it's implemented. FERC has been most, I guess, proactive committee that I've definitely worked with this. So it's separate.
Who are the chairs right now? Who are the chairs of
Sarah
FERC right now?
The co-chairs are Sarah Selk and Heidi Lockwood. Sarah Selk of Three Rivers and Heidi Lockwood is from Southern.
Is Heidi one of the people that's working full-time at the system office?
No, Heidi is a professor at Southern.
Different Heidi. Different Heidi. Okay.
Different Heidi. Heidi Lockwood, yeah.
Yeah. Okay.
All right. Is there any further discussion? So let us conclude this higher up on the agenda for the meeting, let us say the 29th. We already have two items for the meeting of the 7th, but that would still give time for, constituting or providing names for the fall if we did that on the 29th. Is that
Thank you. I appreciate it.
Okay, good. Well, that's our last item of business. I don't know if there's any other business. If not, I think that we can entertain a motion to adjourn, understanding that we are going to adjourn to a special meeting on August the 7th, of which the two items of the agenda.
David, there is someone who has other business. I see a hand going up,
I'm
right?
sorry, yes, because I'm sharing my screen, I can't see it. Let me do that.
David, it's Bill, and I just want to say thank you to you, Kalina, and everyone for inviting me to your meeting. I didn't talk too much, but it was very interesting, and it was good to be with you for this afternoon. So thank you.
The good news is you appreciate being here. The bad news is we'll invite you again for the 7th.
That's right.
All right. Thank you.
I'd like to thank you for the invitation as well.
Okay, Fred. Is there a motion to adjourn?
Franco, so moved.
Second.
Those in favor, say aye.
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 Opposed and who want to stay here until tomorrow, say nay. Abstentions? All right, folks, we will send the agenda out for the special meeting on August 7th, in the week before that. Good meeting. Thank you all for your attendance. Bye.
Thank you.
David. See you soon.
Thank you, everyone.
I like the beep beep as people.
All right, I'm heading out now. I was just making sure I didn't miss anything in the chat. I'll talk to you soon.
Okay, bye now.
Bye.
Take care.
Okay, bye, Fred.